commonly asked topic. The topic is important. So there is a 40-year-old alcoholic male. He is taking regular NSAID. So there are two clues here. Alcoholic, NSAID. For headache, and now he comes with sudden onset vomiting in blood. Means he's having hematemesis, he's an alcoholic, he's taking NSAIDs. Pulse is high, blood pressure is borderline, he is not on any anticoagulant. See, they are giving you so much information. Abdomen examination is normal. Endoscopy is done, which shows the following. So they have given you an endoscopic image. The recent NEET exam had endoscopic images, so you should know a little bit about them. And what do you see here? You see this. Something is, bleeding. It's like a spurt, kind of. You get only this much in the image, yeah. What is the appropriate management? Now, if you feel he is having hematemesis for some reason, and this is the reason, and you can't make out what this is, at least you can see the options and you can use the history. Alcoholic male, regular NSAIDs, who has hematemesis. What could be the common reasons of alcoholic male with hematemesis? It could be variceal bleed, portal hypertension, cirrhosis. Regular NSAIDs, what does it mean? It could be a peptic ulcer bleed. So these are the two common differentials, but anything could be the differential. Now see the options. Injection terlipressin. Yes, terlipressin is given if it is variceal bleed. Band ligation again is done for variceal bleed. PPI is not a definitive management. Okay, so PPI will not be the answer. What is this dual endotherapy? It is used in management of peptic ulcers. So I just have to identify, is it variceal or peptic ulcer? I get the answer. Obviously, this is not a variceal bleed. Varices are very large dilated veins. This question came in NEET, recent NEET. This is a peptic ulcer bleed, plain and simple. Answer is going to be dual endotherapy. Now let's understand this question a little bit more. See the clinical stem and see the question that I have put for you. First, how is peptic ulcer graded or endoscopy? If you see this, what grade would you give it? So this is given by someone called as Forrest. So there is a Forrest grade. What he says, 1A, 1B, active bleeding. In 1A, the bleeding is from the artery. It's a spurt. In 1B, the bleeding is from a vein. It is ooze. So only 1A, 1B are active. Then you have 2A, 2B, 2C. 2A is where there is a visible vessel. 2B is where there is a clot, a large clot sitting on the ulcer. And 2C is where there is just a dot, a small dot, old hemorrhage. And see, there is no evidence of recent bleed. There is a clean ulcer. So these are the Forrest grades. Obviously, since this is an active bleed, this will either be 1A or 1B. Right? It will either be 1A or 1B. Looks like 1A because it looks like an arterial spot. It does not look like an ooze. Now, why is it not variceal bleed? Of course, endoscopy is not showing variceal bleed, but is there anything on history which will go against variceal bleed, which if I use my brains will tell me, yes, definitely it's not variceal bleed. So definitely A and B are out. So definitely answer is dual endotherapy. What is that? What goes against variceal bleed? You said, sir, he's alcoholic. But very important, abdomen exam is normal. Whenever there will be variceal bleed, that means there will be portal hypertension. The patient should have at least one of these two findings, if not both. He should have a splenomegaly and he should have ascites. Ideally both, at least one of the two. This patient has neither. Plus see, he's only 40 years old. Is it really likely that he'll have cirrhosis with portal hypertension? No. Plus the image is of a peptic ulcer bleed. So this is a peptic ulcer bleed. What does dual endotherapy mean? Dual endotherapy simply means when I see a bleeding vessel, I have to do either an injection adrenaline to stop the bleeding. It is done with the help of endoscope, local injection adrenaline. Or I have to clip the vessel, or I have to coagulate. But I don't do any one of these. I should do two measures to stop the bleeding. Means adrenaline and clipping, or clipping and coagulation, or adrenaline and coagulation. That is called as dual. So the management of bleeding peptic ulcer, on endoscopy is going to be dual. Do two of the three things to stop the bleeding. The risk of rebleeding will be less.